आज बात करते हैं 5 important X-rays that are really important if you are working in a clinical setup. So first one in the list is pneumothorax. What is pneumothorax? Pneumothorax is when the air gets trapped between the lungs and the chest wall, means between the pleural space. So how does it look on the X-ray? On the X-ray, you will see there is a white line. There is a visible pleural lining you will see on the X-ray. Second, the affected side would be more darker, means hyperlucent will be there. And if it is tension pneumothorax, that is the life-threatening emergency, you will see the mediastinal or the tracheal shift to the opposite side, right? So how do you treat the tension pneumothorax? It will be treated by needle decompression or cut open, right? So this is about this pneumothorax. So next on the list is pleural effusion. What is pleural effusion? Pleural effusion is when there is fluid is accumulated in the costophrenic region. So how does it look? Costophrenic region look blunt, and when there is in the normal chest X-ray, you will see it's big pointed. So this is the difference between the normal and the X-ray who is having the pleural effusion, right? So now third on the list is the chest X-ray of the TB patient. So how do you see on the chest X-ray? You will see the small cavities, there is consolidations, and you will see the bronchohilar margins and the lymph node enlargement you will see on the chest X-ray, right? So, but if it is miliary TB, so you will see the millets. Millets means like a pulses. So you will see the millets like small cavities that is spread all over the lungs. So that is the miliary TB. Okay. Now fourth on the list is cardiomegaly. How do you see on the chest X-ray? So for this you need to know about the CTR. So the cardiac diameter should be half of the thoracic diameter. So this is the CTR ratio. Okay. So now fifth on the list is COPD. What is COPD? COPD is chronic obstructive pulmonary disease. So what do you see in the chest X-ray? You will see the lungs are more hyperlucent, means the lungs are more darker, and the diaphragm is flat. No any dome shaped structure, you will not see any dome shaped structure. The diaphragm is flat. Why is it so? Because the carbon dioxide is trapped inside the lungs, right? So more carbon dioxide is there, so more air is there, so more blackness is there. So the lungs, you will see the lungs is more dark. So how could you miss this X-ray? This is pneumonia. What is pneumonia? Pneumonia when you will see the fluid in the alveoli. So in this X-ray you will see that